My name is Victoria,
My name is Maria Gomez.
and today we'll be talking about the therapeutic use of horseback riding. Therapeutic horseback riding utilizes traditional riding techniques and adapted riding activities in order to achieve therapeutic goals. Therapeutic horseback riding is classified into four main approaches to serve people with disabilities that addresses psychological, physical, social, and behavioral goals. These different approaches are used depending on the goals identified by the participant. The Professional Association of Therapeutic Horsemanship International uses the title of therapeutic riding to describe a range of activities a certified PAP International employs while implementing therapeutic horseback riding interventions. These two approaches to therapeutic horseback riding are classified by equine assisted activities and equine assisted therapy. Equine assisted activities includes a range of activities that include riding, mounting, ground activities, grooming, and stable management, in which the stable's environment, staff, or equines are involved. Equine assisted activities include riding, driving, and interacting vaulting. Therapeutic horseback riding uses the movement of the horse as a therapeutic tool. The aim of riding is to enable the participant to have increased functioning off the horse. Specific exercises that may be used in horseback riding include mounting, stretching, balancing, strengthening, using a line, jumping, vaulting, driving, and incorporating games. Hippotherapy is a treatment strategy incorporated primarily into physical, occupational, and speech therapies. It does not refer to riding lessons, but instead to a prescribed treatment that is implemented by a credited therapist. During hippotherapy, the patient may be positioned on the horse facing forwards or backwards, sitting sideways, or laying prone or supine. While in these various positions, the participant responds to the horse's movement. Another method is developmental riding therapy. It is a multidisciplinary approach to providing treatment services to hippotherapy participants who have met their long-term goals and are ready to transition to a more challenging program. The elements of developmental riding include sessions with a therapist-controlled sensory stimuli, client-centered focus, use of positions on the horse that correlate with horse's natural movement, and development of relationship between participants, therapists, and horse-selected components of riding skills. Equine-facilitated psychotherapy is used to assist participants with psychological issues or mental health needs. A licensed mental health professional works with the accredited equine professional to facilitate identified mental health outcomes.
I'll be introducing the history of horseback riding. It started with the ancient Greek, and they stated that the outside of a horse is the best thing for the inside of a man. For centuries, scholars have been aware of therapeutic horseback riding elements that horseback riding has to offer. Horseback riding was given to people that were untreated and to improve their spirits. It appears that the value of horseback riding was first documented in Paris, 1875, when Chasing wrote that horseback riding was beneficial in treatment of paraplegia and other neurological disorders. French physician Cassin conducted the first study of determining the usefulness of therapeutic horseback riding in 1875. Cassin concluded that the therapy was beneficial in treating neurological disorders because horseback riding improves posture, balance, and psychological perspective. The North American Riding of Handicap Association, founded in 1969, served as the leading committee to many horseback riding groups in the U.S. and in the United States bordering neighbors. NARHA provides the safety guidelines, training, certifications for instructors, accredited THR centers, information systems, offering low cost insurance to member organizations. At the turn of the century, during World War One, many men were hurt, and horseback riding wasn't such an advanced thing. So Olivia Sands had brought her horse to Oakford Hospital to allow men who have been injured in the war to benefit from horseback riding. Horseback riding then became more popular throughout time, and hospitals realized that horseback riding was a therapeutic program, but it didn't become a therapeutic program until the 1950s.
Discussing the theoretical foundations of the felicitation technique. In 1970, it was developed and undertaken for a theoretical construct for what was recognized as a therapeutic riding. The German theorist designed a three-circle diagram that illustrated approaches taken and theory behind the service provision in this field. The three circles represented education, medical benefits, and sport. The three circles overlap to represent the holistic approach taken by therapeutic horseback riding and its ability to address several different types of disabilities through comprehensive and integrative services. Since then, therapeutic horseback riding has become more popular and additional approaches have been used to provide these services. The NARHA developed a classification system similar to the theoretical diagram. This classification system is a circle diagram as well, which contains 4 circles that overlap instead of 3. The 4 circles represent therapy, education, sport, and recreation and leisure. The point at which all circles overlap represents an integration of all 4 approaches. Although the approaches may utilize individually, the theoretical model reflects benefits of early theorists and has been adapted and accommodated growth of therapeutic horseback riding. The theoretical model changed to an equine-assisted activities and therapies approach to therapeutic horseback riding.
So in 2012, researchers explained the effects of horseback riding as experienced by a 44-year-old male veteran with a C3-C4 incomplete spinal cord injury. Accumulative data regarding the participant during riding experience were completed over 2 years through a source of interviews. To facilitate his riding, a horse with a cooperative, calm temperature was chosen to decrease any injuries that the patient might have. To promote safety during each ride, 2 individuals walk alongside the horse and the participant wore safety gear. The participant started the lesson helping him identify which muscles he needed to focus on at home, and that he felt more comfortable and more confident. The following 2 years of therapeutic lesson, the participant reported decreased muscle spasm in his legs.
In 2011, researchers investigated the qualitative effects of therapeutic horseback riding on 13 adults, 6 of which had schizophrenia and schizoaffective disorder, 6 mental health professionals, and the riding instructor. Data was collected through a series of interviews that occurred pre, during, and post-intervention. The following themes were identified in this interview. Patients were considered to have more fun, developed a bonding relationship with the horse, and increased their confidence and self-esteem, as well as the relationship gains from the participants. The researchers cautioned that the therapeutic horseback riding might not be an effective treatment strategy for every individual with schizophrenia, as there are concerns regarding allergies and fear of the horses. Research was in 2009 where researchers studied the effects of therapeutic horseback riding for 12 weeks on social functioning in 19 children that were diagnosed with autism disorder. 15 children were waitlisted and served as the control. Two scales were used to assess social functioning pre and post intervention. The participants were instructed on mounting riding and performed exercises such as Simon Says, completed grooming and horse care tasks. Compared to the control group's THR, participants showed gains in several areas of social functioning, improvement in sensory integration and directed attention, and social motivation. Results supported that the THR could be viable therapeutic treatment for children with autism disorder. For our implementation exercise, we will be conducting an exercise on therapeutic horseback riding on a patient with cerebral palsy. Before our implementation exercise, we will need to assess the horse and make sure that it is not hyperactive and well trained in order for the patient to be able to conduct the therapy. Once we have assessed the horse, we must make sure that the patient is also aware of guidelines and safety precautions to conduct this horseback riding therapy.
Also, when picking out a horse for the specific patient, the horse must be at a proper height level for the patient because some patients might be afraid of getting lifted. The horse must be like she said, it must be trained.
Riding, we can implement many activities for individuals with disabilities. We can implement activities on patients with cerebral palsy, like take for example, Lewis has cerebral palsy and cannot move his right side of the body. By using horseback riding, we would give him activities where he would be using only the right side of the body. In other cases of patients with cerebral palsy, you might need to perform other adaptations for patients who are in a wheelchair. If they are in a wheelchair, they may need to be lifted from the wheelchair onto the saddle of the horse. The therapist must make sure that they are safely and properly put on top of the saddle in order to conduct the therapy session.
Horse alongside with the patient while riding. One activity that can be implemented with horseback riding would be using large number cubes in order to help the patient with adding, subtracting, right-hand coordination, and left-to-right discrimination. Some basic therapeutic horseback riding equipment would be the saddle that the patient or person would sit on, the stirrups where the feet would go, and the rein.
Some other adaptations that could be made to other patients with other disabilities could be regular ladder reins or looped ladder reins, including therapeutic riding bolsters or hippo helpers.
So to conclude our project, horseback riding has been acknowledged as a form of therapeutic recreation, offering various activities for many different concepts. Therapeutic horseback riding can provide education, sport, and recreational accomplishments, physical accomplishments, cognitive, behavior, psychological, and social goals. In this sense, it approaches to serve provision and quite similar to therapeutic recreation.
In conclusion, it has been determined that therapeutic horseback riding is an effective treatment intervention in working with participants diagnosed with mental health disorders. Studies have showed that interactions between participants and horses was associated with increased self-confidence, self-esteem, and self-concept. Consideration of allergies to horses and fears of horses should be addressed prior to implementation of this intervention. and any use of therapeutic horseback riding.
Concludes our presentation on therapeutic horseback riding.
Thank you guys for watching. Bye.
Have a good one.